Are you guys having a demo?
My name is Shirley Gates. I am the president of the local union here, 1216, right across there. And the way they're trying to do away that contract, we have 66 articles, and they try to take 44 of them. They try to take our annual leave away. So if you got temporary promoted to another position, they usually pay you after 10 days what that temporary position entails. Now they're saying if you get in a temporary position, we don't have to pay you. So they're just taking our rights away as employees.
My name is Jonita. I'm chief steward. What happened is once they do away with our rights, people are going to leave. You could go to Kaiser, make more, and you're protected by their union, and your job is more secure. Here they're trying to turn it into a fire at will. And so once you do with that and people leave, you're not going to have enough people to provide care for the veterans.
Right.
So what's going to happen? They're going to end up saying, okay, well, we need to have privatized, send them out to other healthcare, which is going to cost the veterans more money to pay for healthcare on the outside. When they get it here for free, or they might have a $35 copay if they work. So going outside is more expensive than coming here to get, healthcare. And they fought for us. So why can't we fight for them,
right,
and give them healthcare that they got promised when they got in? Every male in my family is a veteran. So every male in my family is going to be affected by this.
Karen Cash? Yes, I
facility.
do work here. Yes, I am concerned.
What concern?
Well, the VA privatization, the move towards moving veterans care outside of VA, I think the quality is not as high. Community practitioners may or may not know what the special needs of veterans are. I feel like we offer better care, and we offer more integrated care. It's all in one place versus scattered throughout the community, and we can't really guarantee what they get.
Kind of starve the beast, as the people say.
I'm not sure, honestly. I mean, they've said in Washington, they've said that it's not going to take money away, but it seems like it has already. In the past, we had a dedicated pool of money for the choice program, but that's sometimes insufficient. And where do they get the money if we need more than they're providing? I don't know. I think it comes out of the VA bucket when they run out of the other bucket. And it seems like we're going to run out pretty quickly because they've made the eligibility criteria so broad that any person who would like care in the community can get care in the community, which would be great if I thought that they were going to be going to some wonderful, private care that was somehow better, but I don't think that's the case. I think they're going to something that's worse and more expensive.
And the wars that the United States is involved all over the world, I mean, it seems like, and also the fact that military people are going on 5, 10, 13 tours.
Yeah.
I mean, in war zones, what does that mean for the psychology of suicides? I mean, is that a concern?
Oh, absolutely. And I'm not involved in policy making, so we see the aftermath of what happens in war.
But it used to be in the military, maybe 2 terms or something like that. You go twice, but now 5, 10 terms.
Yeah, or in Vietnam, you do 1 tour, and now you do, unlimited tours. It's a smaller number of people doing a larger number of, all of the work is done by this small sliver of people because we don't have a draft. We're not putting our money where our mouth is. I'm not saying I want a draft. I don't. I have a son of military age.
The people that are in the military are face even more psychological problems because of what's happening.
Sometimes, yeah.
So you actually should have more staff and support for veterans.
I wish we did. We have a lot of people who want care, and we have to just do our best to get them in as quickly as we can. And I worry about that sometimes, that we can't do more. People are stretched, and they're really trying, and they care very deeply. They want to get.
I mean, the number of suicides now in this country of veterans. I mean, it seems like it's skyrocketing.
Yeah, and the important fact about suicides is that actually most of those suicides are folks that have not come to VA. And that's not well known outside of VA providers. It's not well known that there's about 20 per day, and about 14 of those are actually people who have not been to a VA in the past year. So
why wouldn't they go? Why wouldn't a GI go to VA if they have psychological problems?
well, think about how we're portrayed in the media.
My name is Sonny Francis, and I'm from San Francisco. Well, they're going to take it and make it not so responsive to our needs. Privatization, I don't think is a good idea. I've been coming to the VA since Vietnam, and the service has been wonderful. And I've noticed as of late, I have been outsourced to other places in the Bay Area for services, and it's not the same as coming to the VA hospital.
So they're cutting back the services there. You have to go to other places?
Yeah, there in some instances, yes.
And what's behind it? Why do you think they're doing this?
Money, greed, they don't care about us. Those guys that are doing this never served in the Army, so they don't give a damn about what happens to us.
Them ways of privatizing the VA.
What is choice?
Choice is basically saying, I don't feel like coming down here, it's too far, so I'm going to go to this private hospital to get my x-ray or whatever I need to get. Okay, the VA only going to pay $75 of that cost. That private doctor is then going to turn around and charge you $200 to $300. When you could have came down to the VA, they're going to pay your travel pay. If you need to spend the night, they're going to put you up. So that's what's wrong with choice. And choice was another one they try to implement under SNEAK to get you to go to a private hospital so they can privatize. On the union side of it, they trying to contract out. They're trying to get all these contractors in here and do away with the veterans' jobs. Exactly.
How long has this been going on?
You're not going to give us the pay of a public worker. A private, you make more money, so we're here, we would, if we went to Kaiser or something like that, we would make more money. You know what I'm saying? They're not going to pay us.
We make 25 to 35% less than private sector.
Exactly.
So we're here because we want to serve for the veterans.
We want to serve for the veterans. This is what we're
Do you think this government really cares about the veterans?
I don't. It's obvious. I mean, look what's going on. Look what they're trying to do. So I wonder.
And how long have you been working here?
20 years. Not at this VA. I worked at Palo Alto VA as well. But altogether, I just got my 20-year pin last week.
The attack on the unions, Trump is not a union-friendly...
No, he's a businessman, right? So he's a businessman.
You think he wants to break the unions?
Yeah. Of course. It's then he can control this better if he broke the union. If the employees don't have a union to come to for their rights, of course, he can control and do what he wants in the VAs.
Give it to his friends?
And give it to his friends, the 1%.
I feel if you really say you care about veterans, then this is not what you'll be doing. Mm-hmm. If you care about the military, they're going to need the VA when they get out. Exactly. Who's best to serve veterans and military than the doctors who work for veterans and military? Exactly. When you send them out with this new act, you send them out there, they don't know these PTSDs or all these other diseases.
They're real specialized.
Mm-hmm. These are specialized care, and you need to keep the veterans coming to veteran specialists, not someone who's never dealt with a veteran.
And you say that the administration, the Trump administration, is trying to push anti-union stuff on your contract. How does that affect the workers?
It brings down morale. People can go other places and get jobs.
Right.
So why take a job 25% less or 35% less when you can go somewhere else and make more? We're here because we care about our veterans. We're not here because of the money. I took a pay cut coming into the VA 10 years ago. I came for the veterans. Like I said, every male in my family is a veteran. Mm-hmm. I came to care for the veterans.
And, the morale is already down here.
How is it down?
Because they're implementing things, they're contracting out.
What are they contacting now specifically?
like EMS, environmental, the environmental, those are the people who keep the hospital clean. They're contracting out the MSAs, the ones who check veterans in when they come into their appointments. And it was somebody else they about to contract out as well. But it's really bringing the morale down. They're changing, they're just implementing things, and they're not bringing it to the union. You're supposed to bring things to the union.
That's conferred before they
That's part of the contract.
So they're violating the contract?
They violating the contract.
Is that union busting?
That's union busting. Yes, it is.
My name is Suzanne Gordon, and I am a journalist and healthcare researcher, and I write about veterans healthcare and healthcare systems, private health sector healthcare in America. And
What's happening today? What is today?
well, today is the rollout of the Veterans Community Care Program under the VA Mission Act of 2018. And basically, Congress, pushed by Republicans and a lot of Democrats who favor privatization of the Veterans Health Administration, and the Trump administration passed legislation in 2018 that will essentially outsource a lot of care to the private sector, veterans care to the private sector. And the problem is that private sector providers are not qualified or competent or even interested in treating and learning about veterans' very specific healthcare conditions.
It's a specialized type.
Veterans have really different problems than civilian population. I mean, not that the civilian population doesn't have very particular problems, but these are people who have military-related problems, more pain. In a market-driven healthcare system, and there are a lot of people who look at the VA budget and say, why is that going to the public, to a public service? And they think it should be going to private sector doctors and pharmaceutical companies and medical equipment companies. And the fact is that the VA delivers better health care that's equal or superior to the private sector at lower cost with better outcomes. And so why would you want to mess with a winning formula? The only reason you'd want to mess with a winning formula is if you didn't care that much about the product, but you cared about the profit. And I think that's what's happening here. So the Mission Act, which sadly was championed by a lot of veteran service organizations and an overwhelming percentage of Democrats, who don't really understand healthcare, or the VHA, the Veterans Health Administration, is really a series of steps towards turning the VA into an insurance company rather than a payer and provider of care. And because it's a payer and provider of care, it can deliver better outcomes. If you separate the payment from the provision, you end up what we have in the private sector, which is a very broken healthcare system. And, I think the thing that's really important to understand is that veterans have really specific healthcare problems that are related to their military service, whether it's Agent Orange related diabetes or depleted, exposure to depleted uranium, burn pits, military sexual trauma, combat trauma. They have very specific problems. You have to understand your patient population. The VA understands its patient population because that's the only patients it served. If you're a private sector provider, even if you're very well intentioned and you want to help veterans, it doesn't pay you to learn about their problems if they represent 1 to 5% of the patients you see. The reason why the VA specializes in veterans is because that's all they see is veterans. Why would you want to, how can you expect private sector providers, who may be extremely well-intentioned and qualified, to take care of non-veteran patients? And the irony is that the VA leadership who is putting this in motion, Wilkie and Stone and Trump, they acknowledge, at least Wilkie and Stone, that private sector providers who might have excellent outcomes with their private sector patients aren't going to have excellent outcomes with veterans because they're different.
Because Davis is I'm Arla from the San Francisco chapter of Veterans for Peace. We're out here today specifically because today is the day the new rules that were promulgated under the recently passed Mission Act go into effect, which are the rules that set the VA up for the attempt to privatize it. We're here to call attention to that and to save the VA from privatization.
I really feel like we offer a better product than the community, and I'm sad to see that this it seems to be moving towards privatization. The book Best Care Anywhere by Philip Longman is an excellent example of somebody who really believed that private care would be better and then came to VA to find out, because he was looking for the best care for his wife, and found out that actually VA offers better care than anywhere else. And he was astonished because he was a proponent of private care.
Some people work wonderful with the union. They don't want the union to go. See, I done work another VA, and they like the union being in place because they know what the union gonna tell you what's wrong with your house. But here, they don't like the union. They don't work with us. We can't work with them. So it's constant.
Is there a war on labor in this country?
Yes, it is. Under this administration, it is.
This choice program, what effect has that had on the hospital? Where you can go to private doctors? Okay, go.
I'm a resident of New Mexico, which happens to be the 5th largest state in relation to geography. It's also the poorest state, but at any rate, our regional medical center, which is in Albuquerque, services the entire state of New Mexico plus western Texas. So as that's such a commute, for me it's a mere 190 miles, we have a growing network of outpatient clinics. Mine's 40 miles away. And that's a real boon to people who don't have a car, don't have public transportation, whatever. Ride sharing works for that, but ride sharing for hundreds of miles away is tough. But with the outpatient clinic, with the prescriptions by mail, my prescriptions come from Texas, with the telemedicine, the VA has been able to make a real effective effort to service all veterans, no matter where they be, on tribal lands, on remote communities, or in cities that are greatly distant from the medical centers.
So if you got people going to choice, if you got somebody going out to different hospitals on that choice, what is that going to do for us here?
And also the records and knowing what's going on with the veterans. How can you track that if you're going to private doctors and different systems?
Exactly, you can't track it. You
really don't know what's going on.
And basically, I'm gonna tell you what's wrong with the choice. The veteran get better care at this hospital because you have a history here. The doctors knows what's going on with you. Some doctors here have became, this is your private doctor. My doctor know how my body works. When you go out there, they don't know what's going on with you. They don't have the history with you. So, yeah.
And this is a national day that AFGE is called. What is AFGE?
AFGE? What is AFGE?
American Federation.
We are AFGE. We are AFGE.
How many workers do you represent here at the hospital?
Right now we have 1,100, but right now we have bargaining employees. We have about 640. That's under our membership.
And these contracted out jobs, are they union?
No. And I'm gonna tell you another thing. What I don't like and what is my pet peeve is in environmental management service is where the veterans clean up. Most of those are veterans. And it's sad for me to say that these guys, instead of going home to a warm house, apartment, they go home to sleep in a car. They're homeless. We have a homeless problem here that needs to be addressed. I mean, if you're working for the government, why are you homeless?
So you're saying that they have veterans here at these contract.
Some employees.
The employees are homeless.
They're homeless. and they won't look at their pay. They won't look at anything. We work for a federal government that we proud of the American allegiance. You know, like the flag. And you mean to tell me the government have a homeless problem? Come on now.
I've had a veteran when he did choice. He went to see specialty care. The VA only paid $75 for the visit. The visit was $310, and he got billed for the rest. And he said, well, I didn't understand it. And I was like, we had to explain to him that the VA, the government negotiates at first, just like Medicare and Medicaid. They negotiate a set price. You can come to them, but you're going to have a copay. And I also realized is that they said, well, we're using choice and privatization to get rid of the wait times. The wait times are just the same outside.
Bad.
It's the same. So it's no difference.
Well, I heard that there's a shortage of staff here at the VA.
Yes.
Yes.
But that's because of this administration, and it's not including this one, but the head administration is making it hard. They don't want to hire people. We have nationwide, the VA has over 49,000 jobs positions.
The jobs that are open.
So that means if you have these positions not being filled, that veterans are not getting the
Privatize
card.
it. You can contract out and you can privatize.
And so they cut the budget for the positions, and then they say, well, we can't serve the veterans because we don't have enough.
The people.
Is that a scam?
Yeah. I think it is a scam, even with HR and how long it takes them to bring somebody in. It takes up to maybe 60 days for them to bring somebody in. They done did the interview. They done had about 5 people, and out of them 5 people, only get 1 because everybody can't wait that long to eat. So
It's kind of like the idea of starving the public services, starving the post office, starving the VA, and then saying the service is bad, you have to go someplace else.
yes, I'm going to let her answer that.
I can say that under the other administration, because I don't want to get in trouble mentioning, for other administration, that he made it easier to bring employees in because he realized there was a lot of holes and gaps to fix these positions that were opening. Now they're making it harder to bring people in. Not only that, they don't want to pay. San Francisco, I'm gonna speak for San Francisco. It's it's the highest rated place to live. Why can't the salaries compare? But they won't. They won't raise. You got to raise everybody. As for EMS, the minimum wage in San Francisco, I believe, is $15.50. EMS starts off at, I believe, $14.
So you're saying that people who work in EMS in this hospital are making less than the minimum wage?
Some brand new people are, and they only top off at maybe $18 or $19 an hour.
How do you live in San Francisco on $18 or $19?
You can't. You can't. They're living in cars or they sleeping on someone's couch.
Is this the situation of employees here?
Yes, it is.
Workers here?
Yes, it is. A lot of workers here are homeless or they live in, well, technically the technical signs of homeless is that you don't have your own place. So even renting a room, you're technically homeless. If you're sleeping on someone's couch, you're homeless. So there's a lot of employees here that are homeless. They don't have their own homes. And how does this affect? What I've realized is we have a lot of employees leaving and not coming in to work. So what does that do for the veterans? First of all, they changed the employees' work schedules so we can provide excellent care. Not only that, you double the stuff they got to do. So they're getting stressed out, so more and more people leave.
But I'm going to tell you another thing they're doing and everything. At the probationary period, they are firing, instead of working with the employee, they're firing them. It's expensive to hire. Why are you firing? Why not give them extra training if they didn't know it?
Try to improve
Try to improve what they're doing. They're firing them. You know, and it's hard for us to fight for them when they're in a probationary status.
You think that's another tactic to?
That's another, to me, all these are tactics. Why? Because you wonder, why are you trying to get rid of these employees when you just hired them? It has to be something else. What are you doing?
What does management say? They don't even want to talk to the union.
Well, no, and they doing all these, I'm going to tell you another thing they're doing, progressive disciplinary action. So it used to be with the contract, if I got an admonishment 5 years ago, that wouldn't affect me when I got in trouble again. What they're doing now is pulling this stuff back, because after that admonishment is gone, we start all over. But what they're doing to us right now is that they're taking that 5-year-ago admonishment and tacking it up and trumping up your charges to a suspension.
Trump had came out with a plan. It wasn't pretty good, but it was supposed to be aimed at management. As you heard about the fiasco in Phoenix, Arizona, where they were booking people and they were hiding records. Well, it was supposed to hold management to a higher standard, because that's where the problem happened, in management. But they put it on the low-level employees.
It's called the something act.
Right, it's a certain act. I can't think of the act right now.
They're blaming the workers who do the work instead of the management.
Right. It should have been held at management and not at the employees. So what was supposed to help get rid of management, they're using to get rid of the employees.
People that do the work.
The people that do the work. And so then you're like, but the person did something 7 years ago, and they might have got suspended, but 7 years later, they do something again, okay, you're fired. It was like, but that was 7 years. That means he changed in that 7-year period. So how are we going to hold him to that same standard?
Exactly. There you go.
You got to give them another chance. Like, okay, they changed in 7 years.
Unless they want to get rid of the public workers and bring in contract workers.
Contract workers. And they don't have to pay them no benefits. They just pay them money, and when they want to get rid of them, they can.
They have no protection.
They have no protection.
My name is Eli. I thought that I went hard. I wrote the book of Eli, Denzel Washington. I love the VA hospital.